So my name is Polina, as we already saw. So today we're going to be presenting a specific case about the parietal lobe that is indicating what the region specifically is going to affect, if there is something going on there. So I'm going to specifically start with the case introduction. So we do have a 50-year-old woman coming into the ER. So what happened is that you can see that this is a really independent, highly functional individual that the past 3 years has been presenting with a few cognitive changes, as her family has basically reported. So that could be just difficulty doing daily tasks, that could be issues with their spatial awareness, and of course forgetting information. So these changes obviously progressed into the point where she had to lose her job and became basically really dependent on her own family. So then we are going to proceed to the cognitive assessment more specifically. So what happened there in the appointment was the Montreal Cognitive Assessment, where the patient more specifically got a score of 12 out of 30, which is indicating specifically that there is multi-domain impairment. So what does that mean? Is that she's clearly showed signs of visual spatial deficits, which means having issues with judging, having issues with localizing specifically objects, and of course having also coordination issues. So she had difficulty with doing tasks when included more coordination. And then of course she also showed apraxia and difficulty with calculating stuff, which obviously that is related to parietal dysfunction. So here you can see her results as well. So give me a sec, there we go. So what you can see specifically here is that the Montreal Cognitive Assessment, the patient went, she couldn't write specifically her sentence, also she even was able to copy the shape here. So moving on, so as already mentioned, so we need to understand more further the cause of that. So a lot of different diagnostic tests are needed to be done. So what is done specifically are CSF biomarkers. So these are able to assess the Alzheimer's disease, to also assess whether, like, the amount of cognitive decline that the patient is showing. Again, and that will also lead us into more specific information. So as you can see here, this is diagnostic done for the patient. Just as you can see, the arrows of the lobes being affected here. And more specifically, so as I already mentioned, the CSF analysis is really important to assess that. So we just check more specifically for amyloid beta, total tau, and phosphate tau, which are specifically biomarkers that are showing for Alzheimer's. Again, further assessments always can be done to evaluate further the extent of the deficit itself. So what is the diagnosis more specifically? So we do have the posterior cortical atrophy that is the diagnosis in this case of the patient. That is a rare neurodegenerative condition that is associated with atypical Alzheimer's more specifically. So obviously that affects usually the parietal lobe along with the occipital lobe, but in that specific case, we saw that the patient had visual and spatial awareness issues that therefore could also lead us more into that. So the treatment, so what is a patient able to take to be better? So obviously in this case, the management is quite supportive, and what you can do is start the patient with cholinesterase inhibitors for their cognitive symptoms. Again, when it comes to motor deficits, you can always give them occupational and physical therapy, as it does affect more specifically the motor, the coordination of the patient. Again, other things that you can do to make their life easier, since they're obviously highly dependent on their family, is to give them visual aids along with environmental modifications to their life and to their house, because that will help them with the daily activities. Again, the prognosis is obviously not the best, since the patient is having decline as they progress throughout the disease, and of course this means that they're also highly depending on their family. Again, their symptoms are mainly managed based on their quality of life to make them feel at least at ease as much as it is possible. So with that in mind, we are going to talk more specifically about the parietal lobe. So when we talk about it, what do we think, what it is essentially talking about the fact that it is the hub of where there is visual and spatial processing, there is hand-to-eye coordination, and of course body awareness, which obviously is then further elaborated into the coordination. Again, that could be having issues with reading, having issues with writing already shown to the Montreal testing, again having issues with calculations. That obviously can further elaborate as we go with a specific disease in this case, without us affecting them in their daily life. So then what else we can further say is that it is really important that the patient in this specific case had difficulty with their navigation, with their depth perception as well. So they had the known features of Gerstensmann's, which what is more specifically is the aculoalgia, which basically means that they have issues with the numbers, along with the fact that there is also left to right disorientation. Again, the imaging also confirmed that there was also bilateral parietal atrophy, as shown already in the envelopes before. Again, also with which is a hallmarker of the PCA. Perfect. So, okay, clinical takeaways is that, so obviously, frontal temporal lobes also are a huge part of this, but in this specific case, the parietal lobe has to do with understanding the space that the patient is living in. So when it comes to familiarizing with their environments, it's really important. So again, when we think of the parietal lobe more specifically, we think of their perception and their visual spatial deficits as well, along with sometimes memory loss as it progresses. Thank you.